Hi, my name is Jasmine Pope, and I am going to explain an SBAR report for Professor Norma's Fundamentals of Nursing Lab. So basically, I'm just going to act like I'm reporting to a physician. And SBAR, starting with S, it starts for situation. So it would sound something like this. I'd call the physician's phone. He answers. I would say, "Hi, I'm calling about Jane Doe in Aspen's medical facility, room 222A. The patient's code status is full code. The problem is the patient is having some bilateral edema to the lower extremities and the upper extremities. I've personally assess the patient, and I'm concerned because the blood pressure is over 200, the systolic. So we had 208 over 110, and her heart rate is tachycardic as well. She has a pulse over 110. It was 113. Respirations are 20, and her temperature is 98.6 orally. Next, I would move on to the background. Basically, I would just let the doctor know the patient is alert and oriented ×3. The patient is not confused. She's cooperative. She's not agitated or combative. I don't notice any lethargy or anything like that. Patient is responsive. Skin is normal, warm. The patient is not on oxygen. And then I would give any other background diagnosis, diabetes, things like that. Next, I will move on to A, which is assessment. I would say, I think that the problem is the patient may be experiencing fluid overload. And then I would just state that the vital signs are abnormal and it seems that the issue could be getting worse. R stands for recommendation. I suggest that the patient be sent to ER for further evaluation, unless you're going to come and see this patient here today. Also, in the meantime, if you don't want to send the patient out, I would just ask the doctor, are there any tests that are needed? Chest x-ray, venous Dopplers of the upper and lower extremities, CBC, EKG, anything like that. And then if the doctor recommended, like, I take vitals more often, if they ask how long I think that the problem could last, I would just answer anything like that. And I would just tell him if the patient deteriorates or get worse, I will call you. And that's how I would give report to the doctor. Thank you.